A new paper published about the coronavirus or COVID-19 experience out of New York City suggests that obesity could be one of the biggest risk factors for severe complications from the infection. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and I wanted to bring your attention to this important publication because as we start to get more information about the COVID-19 infection and what the risk factors are, we want to make sure you're up to date. So this paper was published specifically from the New York City experience, and it was almost 2,000 patients, 2,000 patients out of one health center, people who presented to the emergency room, or at least in the beginning of this to their physician's office, and then in the later part of the observation, it was all in the emergency room. And some of the findings they found were a little bit different from the findings that we see out of China. And so here's why this is important. So first of all, 48% of the positive tests ended up being hospitalized. Now that sounds really high. And taken on the surface, wow, 48% of people with positive coronavirus infections ended up in the hospital. But remember, this was a subset of people who are very sick enough to go to the emergency room. These were not the people who were likely positive and self-quarantining at home. So it's a select population. But of those, the highest risk of needing hospitalization was age. We've seen this before. If you were 75 or older, you were 66 times more likely to need hospitalization. So we talk about relative risks and how nutritional epidemiological studies have relative risk of 1.1 or 1.2. Well, this isn't 1.66. This is 66 times more likely. Now that's a pretty significant risk. And the second biggest risk factor was if you were 65 to 74, you were 10 times more likely. So age far and away is the biggest risk factor, which we knew from a lot of the China experience as well. But number 3 on the list was a little different. Number 3 on the list was obesity, with a body mass index greater than 40, making you 6 times more likely to require hospitalization. Now, interestingly, that didn't come out from the China experience. Now, could it be just different cultures? You know, the difference in obesity between the two countries, certainly possible. Could also be, though, the way we define some of these metabolic conditions. Because as we know from the experience in China, hypertension and diabetes were 2 of the biggest risk factors. Well, what do people who are obese frequently also have? They frequently also suffer from hypertension and diabetes, or prediabetes or insulin resistance. And this is where our definitions are important, because diabetes isn't just you have it or you don't, you turn it on or you turn it off. It's a spectrum, and that's why we have metabolic syndrome, insulin resistance, prediabetes, and diabetes, and it all shows a dysfunction of your metabolic system, of the way you handle glucose, of your insulin levels. And so it's a spectrum, and so it's not like once you have the diagnosis of diabetes, you are at risk. You are likely at increasing risk well before that with these prediabetes type conditions. So I think maybe in this study, obesity could also be a surrogate for that. Now, the study doesn't look into it. That's my opinion. But the point is, why are we covering this? Because we want to impress upon you how important it is to take charge of your health. Now more than ever, it is important to make sure we are addressing our weight, to make sure we are addressing our metabolic concerns, our diabetes, our high blood pressure. And one of the best ways to do that is with lifestyle. Now, obviously, you should be checking in with your physician. You should be talking to your healthcare team about ways that you can improve these risk factors. And we don't know that improving them is going to automatically reduce your risk of severe complication from the COVID-19 infection, but it certainly seems likely that it could. If these are some of the higher risk factors, then it makes sense that trying to control them or reduce them will reduce your risk. And it doesn't mean that now, since obesity is identified as one, you need to go on a crash course weight loss program and lose 100 pounds in, a month or something. No, there's a healthy way to lose weight. And I think a lot of this just reinforces what we try to say over and over again at Diet Doctor, that you prioritize your health, you prioritize your metabolic health, and the weight comes with it. So nutrition, exercise, stress management, sleep, all those things are important. And at Diet Doctor, we want to provide you with the right tools and the right message and to help you as much as possible. So whether it's our Weight Loss for Good course, whether it's our introductory 2-week keto challenge or our 5 weeks of keto with Christy, or any of the other guides, the realistic expectation guides or the health and weight loss guides, we want to provide you with all the materials that you need to help you on your journey to improve your health, because now more than ever, we need to prioritize our health to reduce our risk of severe complications. So I hope this was helpful to some degree. You can see the full post at dietdoctor.com with a link to the article. And in addition to some of the other materials we've presented about the COVID-19 infection and how you can improve your risk of not having a severe complication from it. So be well, take care of yourselves, take care of each other, stay home, but be safe. Thanks, everybody.